Welcome back to the Lars Larson Show. Glad to be with you and really glad to welcome to the program for the very first time Dr. Michael Ciampi. Dr. Michael Ciampi has his medical practice in Portland, Maine, whereas I have my studios in Portland, Oregon. Dr. Ciampi, it's good to have you on the program.
It's great to be with you, Lars.
Hey, I read about something intriguing, what you did with your medical practice this year. You really came out and told your patients, I'm not taking insurance of any kind anymore. Tell me why you did that and how that's working out.
Well, there are a lot of reasons, but to boil it down for you very, very briefly, Medicare and Obamacare are really causing the end of private practice as we know it. If you were to print out the rule book, the regulations for Medicare, depending on the font you used, it would be between 130 and 150,000 pages. And Obamacare, although it was a 2,700-page bill, the regulations that are being generated from it, I think at last count, I think they were at 20,000 pages and counting. And there's no way, as a private practice and a small business, there's no way that I can read all those regulations and comply with them. So we found that the best thing to do was opt out of the whole system and just work for our patients, not for the government and not for insurance companies.
No, I applaud you for doing that. Dr. Ciampi, the other day we were mentioning to folks that physicians right now, if they're dealing with insurance, have to deal with insurance codes. So I assume that a sprained wrist has one code and maybe a sprained ankle has a different code and a busted heart has another code or 10 codes. But there are currently 18,000 different insurance codes that are used by physicians, depending on the insurance, I guess, that you're complying with. They're talking about under Obamacare taking that to 140,000 codes. Two questions for you. One, is there any necessity of that? And two, is it likely to make medical care better or worse?
It's funny you mention that because what you're talking about now are the ICD-9 codes, and they want to move to the ICD-10. And ironically, the United States is one of the last countries to move to that system. And in terms of are they useful, do they help patient care, the answer is I've never seen them do it, but the insurance companies sure like them because if you don't have the exact right code on a bill or on a lab requisition, they love to deny the test. So it really is a way for insurance companies and the government to deny care. It doesn't really improve patient care. And going to the ICD-10 codes, which you're right, are well over 100,000 or so, I don't think it really matters a whole lot if I have a code that someone was bitten by a parrot versus a macaw.
Which is a real and by the way, Dr. Ciampi is talking about real codes. Also being hit by a turtle or bit by a turtle has two different codes.
Right. And there's also one if you get a burn while water skiing. And I don't know that anyone's been burned by water skiing except maybe road rash. If you're going at 60 or so miles an hour, you get some road rash, but I don't know how you get a burn while you're water skiing.
But there is a code for that.
Codes.
Yeah, kind of like Apple. There's an app for that. Now there's a code for that. But when you say that they deny, I don't disagree with you. I've heard about doctors talking about this. At the end of the day, if it's an expensive test, all that means is the doctor gets to, or his staff gets to do more paperwork. It gets resubmitted. The insurance company gets to do more paperwork, and the bill still gets paid. It's just that we eat up more time and effort and money on paperwork instead of medicine.
Well, not necessarily. If the doctor can't find a code that the insurance company thinks is appropriate, they don't necessarily pay for the test.
Oh boy!
And then all of a sudden the patient's mad at the doctor because the doctor told the patient that the test was needed and appropriate. The patient agreed to have the test, but then the insurance company comes in after the fact, says, no, we're not going to pay for it. The patient has to pay that out of their own pocket.
So you told your patients you're going to stop taking insurance and you're going to go to what alternative to that? Because you're still going to have patients.
Actually, we're going back to the way things were prior to 1965, before the Great Society and they passed the Medicare and Medicaid. It's a much cleaner system. I work for the patient, and I look them in the eye and I tell them what I think's going on. I charge them what I think is a reasonable rate. They pay me, and the deal's done. We keep the insurance companies out of it.
Now, correct me if I'm wrong. The patient who comes to you and pays $75 for an office visit instead of $160 like it was when you were still taking insurance, he can still submit that to his insurance company, can he not?
Medicare and Medicaid, you can't do it. And it depends on the person's insurance, because even though you may have Anthem or Blue Cross or Aetna or Cigna, it really depends on what what your employer has bought and what you've picked. If you have an HMO, the HMOs, unless you see a network doctor who is bound by the contracts that they want you to sign, they won't recognize that at all, and patients can't get reimbursed. But if someone has a PPO, a preferred provider organization, then depending on the rules of the insurance company, they potentially could.
How is this going to work out, or how has it been working out since you've been doing this for a while? And I'd remind you that I've told you I'm in a similar kind of situation with Sendon Healthcare, where I pay for a different kind of healthcare, and I actually get a chance to know my doctor. My doctor knows me, and I get a much more, doctor-patient relationship like you have with your patients.
And really what we do is I'm the only one here in terms of providers, so I don't have a physician's assistant. I don't have a nurse practitioner. So if someone comes in, they see me, which really helps the continuity of care and the relationship building. And I have one staff member full-time, and we also have my wife is my boss and office manager, and she's an Oregonian, so she keeps me in line. And it works. The patients who really like this are the people that don't have insurance at all, because when I charge them $75 or so for a visit, if I save them going to the emergency room, I mean, that bill could be easily $300, $500, $1,000 for what I can do for about $50 to $75.
You give the example of somebody who wakes up on a Saturday morning in Portland, Maine, where you are, and has a sore throat, but by Sunday morning they're reasonably sure that red-hot poker down their throat says they have strep. They can go pay $300 at the hospital, or they can go see you for $50. It sounds like a much better alternative.
Well, it is, and for people without insurance, I mean, this is money coming out of their own pocket. What people often don't realize is that when you're dealing with a hospital, or if you're dealing with a doctor's office owned by a hospital, the current regulations allow them to charge double. And you get not only a professional fee for the physician, but you also tack on what's called a facility fee, which often can be the same as much as the fee for seeing the doctor. So if you go to the hospital, the price is at least double what it would be if you went to see your own private physician.
Any other things that this particularly benefits the patients by going this route? And does it benefit you? Do you end up ahead of the game, behind, or about the same?
The other folks that it really benefits are people that have insurance that have high deductibles. Someone that has catastrophic insurance that they have a deductible of $5,000, $10,000, unless you need surgery, have a motor vehicle accident, something like that, odds are you'll never see the other end of that deductible. So these folks are saving real money, because otherwise they're paying full price at the hospital practice or the big box practice. So those people really like it. And in terms of how I'm doing, I mean, I've cut my overhead by about 30% by not having to deal with the insurance companies and keep the computerized records and computerized billing and so forth, and I've been able to cut down on my staff time. So I'm saving money, and I'm happy to pass it on to patients. And I'm not looking to get rich on this. I'm just looking to make a living and send my kids through school and maybe someday start saving for retirement.
Dr. Michael Ciampi is with me. He's in Portland, Maine. He's doing something that I expect we're going to see a lot more doctors do and a lot more patients seek out. That is, he's getting rid of the insurance altogether. At a time when Americans have been told they are mandated by Obamacare to buy insurance, he's saying you might do better for a lot of your day-to-day care by getting away from insurance altogether. We'll be back in just a moment. You're listening to The Lars Larson Show. Welcome back to the program. Let's see. Dr. Michael Ciampi is with me. You're a family physician in Portland, Maine, right, Dr. Ciampi?
That's correct.
All right. So you post the cost of your individual procedures online so that your patients know exactly what they're buying and what they're paying for it.
That's right, I do. And you won't find that most any other place, because most doctors don't even know what they charge for things, because it's really a shell game that we play with the insurance companies, because every insurance company will reimburse a doctor a different rate for the same procedure. So really the what's charged in the doctor's office is really fictitious. The insurance companies basically dictate it, and the doctors don't even know what they charge. So we wanted to avoid that and just provide complete transparency so patients knew what to expect.
That seems like the kind of practice that would ordinarily attract the attention of state attorneys general who'd come in and say you're charging different customers different amounts of money based on their circumstances. It seems like the kind of thing maybe even the Federal Trade Commission would get after if it were done by a private company outside of medicine.
Well, the ironic thing is when I was involved with insurance companies, I would have to sign contracts saying that I couldn't charge anyone else less than I charged their patients. But by the same time, they could pay me whatever they chose to according to the contract. They'd say, well, if you don't sign the contract, we won't send you patients. So, for example, if I wanted to charge, let's say, $200 for a physical, they'd say that's great, but we're only going to recognize $150 of that charge, and according to our contract, we're going to give ourselves a 30% discount, so here's $100, and you have to eat the rest.
But at the same time, were you allowed in that circumstance to charge a regular patient $75 for a physical if you wanted to?
Not at all. I would have to charge that patient. I had to charge every patient $200, and if the patient wasn't covered by the insurance, theoretically that patient had to pay that $200.
Do you think the rest of medicine is going to go the direction you're going right now?
Well, I hope so. What I really want to see is a grassroots effort to do this, because really, if we can have the doctors working for patients and not have the government and insurance companies involved regulating care, denying care, it's a much cleaner system and really things get done. And I recently joined an organization which really advocates this. They're kind of the anti-AMA. It's called the American Association of Physicians and Surgeons, and their website's www.aapsonline.org. And I'd certainly invite anyone that's interested in this, especially any physicians out there, to get involved with this organization, because everything that I'm doing are things that they're advocating, and I've gotten a lot of guidance from that organization.
Doc, I want your insight. I mean, we've got a couple of minutes left, but I want your insight into what this is going to do to the rest of medicine. As far as I'm concerned, you looking out for your best interests and the best interests of your patients is great. But I would imagine that if every private practice doctor out there did this, they'd attract a lot of the business that's now going to the hospital emergency rooms, and some of that is paid. I know that hospital emergency rooms have become giant, red ink factories for the hospital's, revenue situation. So how does this end up rolling out in the way it affects the rest of medicine?
Well, it saves the system a lot of money, and it unburdens the emergency rooms. I mean, if you have to spend $300 to $500 in the emergency room to treat a strep throat, where you could have spent $50 at a doctor's office, I mean, it's going to save the system a lot of money, and I think it would relieve a lot of the red ink, and really the emergency room could be used for treating just emergencies.
And in fact, even with your patients, if they have some catastrophic event, a heart attack, a broken leg, things like that, they may well be going to the emergency room anyway, and not to your office.
Right, absolutely. And I'm not advocating people not have insurance. You want to have insurance to protect your assets if you have a major catastrophic injury. But really, if we could do, cash-based care for things that are not life-threatening, have catastrophic care for things that are, I think it'd be a much more reasonable system. I mean, health insurance is not like auto insurance and homeowners insurance. People that have medical insurance want everything covered by their insurance, but if you have homeowners insurance, that doesn't pay to change your light bulbs, and auto insurance, they don't pay for your gas and your oil changes. If we could make health insurance more like those, the system would work a lot better, and it'd cost a lot less money.
No doubt. Dr. Ciampi, do you want to mention where your website is so people can check it out?
Sure. It's www.ciampifamilypractice.com. That's CIAMPI.
Dr. Ciampi, it's a pleasure to have you on the program.
Great to be with you, Lars. Thank you so much.
Thank you very much. Dr. Michael Ciampi. Now, here's what happened. I read about Dr. Ciampi. The fact that he'd said, basically, I'm not doing insurance anymore. I'm not going to do Medicaid, Medicare, private insurance. People who come to see me will see Dr. Champy the same way that old-fashioned doctors did, fee for service at much lower costs. And I think this is going to be one of the effects that you're going to see out of Obamacare and the real dislocation of the entire system by the government. You've got the Lars Larson Show.
The Lars Larson Show.
I blame Dave